From this summer, thousands of patients will have far greater information about the results of certain types of operation offered by the NHS in England. This means that if you are undergoing surgery, you'll be able to have a more informed conversation with your surgeon about your operation. This will include knowing how many times your surgeon has carried out a procedure, whether it's regularly or rarely. National clinical audits overseen by the surgical profession will be providing information on mortality rates, but some will also provide information on other clinical measures, such as readmission to hospital rates, length of stay in hospital following an operation, and patient experience, such as how quickly a patient recovered from an operation and returned to day-to-day tasks. Here's some members of our patient liaison group with some more information.
For us as patients, it's very exciting news. Having any type of surgery is very daunting and a life-changing experience. But knowing that you can sit down with your surgeon and talk about the type of surgery they perform and possible outcomes will be very reassuring.
For the first time, you'll be able to read information about the details of the surgeon's performance by looking at outcomes of particular procedures and operations. For example, hip replacement or stroke prevention surgery.
The information is based on national clinical audits, and these are a way of measuring the performance of a particular surgeon against expected professional standards.
These are useful things to know, and the fact that the information is available on the NHS Choices website, as well as the individual websites, means that it's easily accessible for patients.
This is a new relationship between a patient and a surgeon, and at the moment not all areas of surgery are going to be covered, but it is a first step, and other areas of surgery are going to be added on in future. It's very important that patients know where their surgeon is not performing to the standard expected. This information will give additional assurance that where that's happening, processes can be put in place to help that surgeon improve.
It's important to understand that a patient's outcome depends on a whole team, not just the individual surgeon, because performing complex surgery safely involves many individuals.
This is a watershed moment for surgery. This new approach is intended to provide you, the patient, with robust and reliable information about the quality of your care, so you can make informed decisions about your operation. We believe that by doing this, we'll be able to drive up surgical standards and continue to improve on the care you receive. Crucially, we also want to help you have a better conversation with your surgeon.